I want to welcome you all in on this Friday. We've made it through another week here together. I'm Katie Rammel. Garrett Archer has the day off, so joining me today is Melissa Blasius. Melissa, I miss you. It's so good to see you in person. We're not in the newsroom anymore, so it's so strange. I only see my friends and my coworkers as viewers do, just in a little screen. So I miss you so much, and it's so great to have you on here today. I know you've been working hard along with all the rest of our team. Where are you today? Tell us where you are.
I'm at my house. We call it now the Blasius Bureau because I'm set up in the living room. You know, so many people are working from home today. We are too, or at least I'm based out of home. And so I go on to my assignments and interviews out of here. My husband is working from home too in another room, and we have our young son at home. So if you hear some people moving about, that's my son making lunch.
Well, it's nap time at our house. So if you hear some cries and screams, that's exactly what it is. So we always dive right into the numbers, and Garrett's not here, but it's no different today that he jumps right on Twitter and he breaks down the numbers for us. So even when he's not working, even when he's taking a day off, he's still working. The numbers that came in today, 4,000 new cases reported. And of course, we passed that 2,000 mark for deaths this week. Such a sad marker in all of this, because we know that there is a family behind every single story there. 44 new deaths reported today. And Melissa, have you seen these lines out at South Mountain Community College for people waiting to get tests out there?
I have. And, you know, and when you look at the numbers of tests that are happening each day. Yesterday, the number reported as of this morning, 19,000 cases were counted just yesterday. So when you think that there's somewhere between, you know, on a low day, like 12,000 and 19,000 cases a day, and there's these long lines of people to get all of those tests, and the positivity rate of those tests, you know, there's a lot of people out there who do have coronavirus who are like, well, do I really want to wait in line for 8 hours to get a test, or is there one available, or there might not be one available? So when we talk about these super high numbers, more than 4,000 cases newly reported today, you know that there's so many more out there beyond what we're even counting.
Yeah, we heard from an 80-year-old grandmother yesterday who had been waiting in line overnight with her family just to get those results in. And if you are planning to head over there today, the lines are long, so be sure to take a full tank of gas, take water, be ready to be out there for a long time. Although the wait is long, once you get up there, they move through pretty quickly, so you're able to the testing part itself moves by pretty quick, but the line is very, very long. So that's the one thing we want to warn of. It is going until 6 o'clock tonight. At least that's the plan. They started at 6 this morning. You do need to bring your ID as well. So those are the things to note if you're heading out there. I want to walk everybody through some of the numbers. And we heard the governor talk about the R-naught numbers yesterday. And if I can share my screen here, I will pull it up to show you where you can find that number for yourself. It's something you're going to want to watch closely as a parent, as somebody who owns a business, as someone who just is waiting for things to reopen. So this is the R-naught page for COVID-19. You can find it at rt.live. It's the easiest spot to sort of jump to. It's color-coded, and you can kind of go down the line and scan here and find Arizona. We're at 1.11 at this point. Anything above a 1 is considered spread. You're going to see the virus spreading quickly throughout the community. Once we can dip below 1, that is when the virus will slow and stop spreading. You see, we only have about 6 states there that are within that green zone, within that okay area. It's a number that we know the governor is watching closely. And if you can see my tab here, back on May 25th, we were all the way up to 1.24. And that whole range is the area of where we could be, but it's a 95% confidence level that we're right on that spot at 1.24. We have worked that now down to 1.11. And again, this is the metric the governor is watching closely. So if you want to know more about the decisions he's going to be making, that's the place to go to that website to find the very latest information on that. So I always tell people to bookmark these because it's easier, Melissa, I think, to just dive into those each morning and be able to find them quickly. And that's why we're here, to help people find these numbers, to take a peek at them, and then make choices for themselves. Nobody wants to be told what to do, but the easiest way is to pick a metric that works for you and your family, and then be able to go check it in the morning and find out where things are. Melissa, some of the stories you've been tracking, what are you hearing from viewers? And as comments come in, I want to remind you guys that in the live comments, if you want us to help you find a number, we can do that for you, or have a question about some of the reporting, we can help you find that information. But Melissa, what were you seeing out there, and what are you hearing from viewers right now?
Well, a couple of things. One of the things that I've heard a lot from viewers is still big concerns about their elderly relatives living in congregate care settings, either, independent living, senior homes, as well as assisted living, as well as long-term care facilities, and what their rights are. Because even though over the last few weeks we've talked a lot about how coronavirus is spreading very fast amongst younger populations, that it's still spreading amongst the entire population. There's still widespread, it's still widespread. And so we have to keep that in mind as well. And then what do you do if your relative is in a facility where they're seeing multiple cases and multiple staff members? And do you think about moving them? I talked to a guy who had a 100-year-old mother just turned 100 years old. She got coronavirus. She made it through. She actually had an asymptomatic case, amazingly. Got tested twice, 2 positives, but she made it through. And he was like, I just took her and put her in
home, right? He brought her to his house. Wow.
With a home health care worker, instead of leaving her in a facility where she's being exposed to a lot of people. So we've heard that. We've also heard a lot of concerns from people who are working in the hospitals now, Katie. We're talking about workers concerned about in ICUs, where they might have 2 patients for every 1 ICU nurse, moving up to 3 patients per ICU nurse, or 4 patients per ICU nurse. So the employees are not only there and working very hard and dealing with a very difficult disease, but they're also caring for multiple patients at a time, and the difficulties there. We know that there are some efforts to try to bring in some additional healthcare workers. When Vice President Pence was here last week, he talked about getting 500 additional workers into Arizona. And so there's other efforts going on at the state level in order to do that as well. We also today, Katie, as you know, breaking news today is that some of the hospitals right here in the Valley have started to bring in refrigerated trucks to service temporary morgues. Now we heard,
and as you bring that up, I want to mention that exactly. Elizabeth just posting about that issue in particular. But Melissa, what were you hearing on this? Elizabeth writes, one of our hospitals, more exact capacity, they're requesting freezer trucks, and that's just one hospital. That's not counting the other hospitals out there. That matches exactly with what you're hearing, with what Elizabeth is saying.
Right. So when we did get some clarification from that hospital system, it's Abrazo, and they said that this is part of their emergency planning, that at this point their in-hospital morgues aren't full, but they're doing this as they plan for the potential that we could have more cases. Because keep in mind, as long as that R-naught factor that you talked about is above 1, we are still seeing an increase in spread and growing numbers all the time. Now, the good news is that if there is some good news here, is that the some of the mask mandates appear to be working as more people are wearing masks. We're seeing that the increase in daily case numbers, that's the number of people who test positive each day, we're seeing those numbers not increase so dramatically every day. Instead, we're seeing smaller increases, or them kind of hovering between like 3,500 and 4,000 new cases a day. And so the people who really spend all their time, who are specialists in data on these kinds of outbreaks, are saying they think that some of the reason for that is that people are wearing masks. Still, 3,500 to 4,000 new cases a day is a tremendous number.
Yeah, absolutely. I want to show folks some other numbers that we have here, and specifically breaking it down by Maricopa County. Let me go ahead and share my screen here. We always get questions about this topic, so bear with me while I pull this up. let's see here. Oops, I shared the wrong one. There we go. Okay, so this is on Maricopa County's page. And this is a really good place to stop if you are in Maricopa County, because it provides a deeper dive into the overall cases and also into the age groups, so you can get a better understanding of how things look each and every day. It's updated every day. It also breaks it down by who's hospitalized, who's in the ICU, and then, of course, the deaths that we've been tracking. And as we've talked about, we passed that 2,000 mark for the state of Arizona just this week, but the deaths in Maricopa County make up half of that. You see that at 1,000 people right there. All these toolbars on the top are really helpful. The age groups, as you can see, a little bit deeper dive into those numbers as well, and how much that affects those who are over 65, but also these age groups growing between 45 and 64, and seeing a 5% there under the hospitalized section. Race and ethnicity is broken down as well. So there are several different areas that it looks like my internet's running a little bit slow too, but there are several different areas that you can pop into and sort of do a little bit deeper dive into those numbers to find out the category that most interests you. Obviously, people like to stay up to date on every single category, but if there's one that you wanted a little more information on, that's exactly where you can find it, at least for Maricopa County. And then you can look back on the past dates as well in there. Melissa, one of the other big headlines that we had just in the past 24 hours is the school districts. And Danielle Lerner has been our reporter on education for a long time, and she has a great Twitter account you can follow. They did a town hall yesterday right here on Facebook Live. And if you missed that, you can still scroll back and watch that. Worthwhile, talking to some education leaders in the Valley. But also a bit of a surprise, Scottsdale schools, the first to push back their in-person date now to after Labor Day. It'll be interesting to see, Melissa, if other school districts now follow suit.
Well, interesting. Other school districts are evaluating this clearly day by day, what we're hearing from them. Hearing from the school district that my son attends, they just put out a note basically explaining why they don't want to start kids online and then transfer them into the classroom as time moves on. And so their goal is to start all kids at the same time when it's safe. That date still August 17th. They moved it back to after having discussions a couple weeks ago when the governor said you got to move it back to August 17th if you want to be in person. And there's talks that it could go later. I mean, it just depends on some of these school districts and the decisions that their individual boards make about. I've heard discussions as late as starting in October.
What are other moms saying to you? Are you keeping up with some of the other moms and dads? And I know a lot of people, at least my friends, will call and say, but what else do you know? You know, we're telling you, we're passing along everything else that we know about this. We're having to make decisions as parents, just like so many viewers are. But yeah, I'll hear from them asking, you know, what are you going to do? I can't tell you. I probably heard from 3 or 4 other moms and friends yesterday asking what the plans would be. Is that kind of the same thing you're hearing out there? And what are the concerns that they're bringing up to you?
Sure. Well, I mean, certainly there's a big trade-off. So, and yes, all the moms are calling me and texting me and going, well, what are you doing with your son? And trying to use that as a guide, knowing that I spend all day, every day talking about coronavirus and its impact and what's happening. What I found was interesting is that a lot of the moms that I've talked to really want their kids to go back to in-person school, but only if it's safe to do so. They found that this online learning, especially younger kids. I have one friend, she has a child who's starting kindergarten this year, and she was wondering, right, like, she's like, do I even start him? Because I can't imagine teaching kids to read over the computer, and making a 5-year-old sit for hours, 4 or 6 hours in front of the computer each day. But you also can't imagine your 4 or 6-year-old being able to keep that mask on their face in the classroom for that many hours a day. So there's a lot of tough decisions for parents to make. And I always say, like, you have to go with your own motherly instinct, right? Like, the school districts, for the most part, as we've seen them, they've put a lot of information online on exactly how they're planning to operate this. And then you have to just make the best decision for your comfortability level and your family.
Yeah. Oh, here's a comment from Carmen. My whole household tested positive. Oh, Carmen, my God. My son, 29 years old, no pre-existing conditions, young, strong, healthy, in the hospital now with COVID and pneumonia. This thing is very real. Please, please be cautious. Carmen, you're absolutely right. That's why we're jumping on here every single day to help you find the very latest information so that you can protect yourselves. And we'll be thinking of you, Carmen, and your family. It's such a hard thing to go through when people are getting sick, and because there's such a variation in how people are affected by this virus. You know, we've talked so much about those who are asymptomatic, but we also have all of those people that are on ventilators right now here in Arizona, hundreds of people at this very moment on ventilators here in Arizona, and people in ICU, people in hospital for long stays. I talk about one of my friends who checked into the hospital 3 different times. So she was discharged 3 different times trying to get over this. She's doing better now. She's got a negative test now, finally. But this can take weeks and weeks. And we always get questions on here about recovery. And I've seen a few of them go by. So I just want to address that. The best numbers that we have for recovery come from a website, and I'll take you there in just a moment. It's covidtracking.com. The recovery is defined differently by different people. That's the easiest way to put it. I always say what's recovered for Garrett is not recovered for me. What's recovered for Melissa might be different than what my definition is. So until there's a set upon definition by what recovered is, we don't have those exact numbers. The best place you can go is covidtracking.com. And I don't have this up on my dashboard. Let me pull it up for you though. 1 second.
And Katie, part of the reason why we don't have really great numbers in Arizona on recovered, I mean, it is because that someone's not calling each individual coronavirus patient who's caring for themselves at home and saying, are you still having symptoms? Are you feeling better, et cetera, et cetera. There is some contact tracing, but even we heard from Maricopa County yesterday or the day before here that only goes so far with the contact tracing, that they at this point don't feel like that they can even handle all of the people who are getting sick every day, plus all of their contacts, and doing that well in order to contain the virus, which is why you keep hearing the same thing: wear a mask, that you are safest at home, do not make unnecessary trips out and about. And so that's why you keep hearing that consistent public health messaging now for the last few weeks is that if you're going to go out, wear a mask. But again, you're safest at home. And then if you're not at home, you're safest if you're in an outdoor area instead of an indoor area.
Yeah, absolutely. Let me hop back in there and share that screen for you. The best place to find any recovery numbers at this point is on, sorry, let me find it here. It takes me a second to maneuver through things. Usually Garrett pulls these up. So here's what our national numbers look like. And this is on covidtracking.com. This is the chart, by the way, for the deaths reported in the US. You see that chart going down. That's what everyone gets confused about, because they see that across the US, but it's important to look at Arizona's numbers separately. Now, how this website works is you just scroll down to Arizona. There's a pull down bar, but I've got it pulled up right here. The outcomes that they are counting as recoveries at this point, 13,341. So that's the best number for recoveries we have at this point. And as Garrett and I have mentioned so many times, that number comes from discharge from the hospital. So because that's the best number we can get to at this point. So that's the closest we can get for you. Bob's writing in and asking, why will no one report on the death rate number? We'll tell you what it is exactly. I didn't do the exact math today, but it was 4.4% when last checked over the United States. Pretty similar to the world as well. And then also, when you're pulling up the Arizona numbers, that percent is a little bit lower. But remember, we are just hitting our peak of people getting tested for this. You don't get tested and then necessarily die of coronavirus 5 hours later. It's because they fight and fight and fight. Man, these people are fighting for weeks and weeks to try to be better and to get out of the hospital. And at that point is when we could lose them. And so that's why those numbers lag. Remember, the death numbers lag. So if you want to look at a bigger sample, a broader perspective on all this, we're always right around 5%. When this thing first started and the numbers were coming in, it was at 7%. and it's currently at about 5. So today or yesterday when I last checked, across the US, it was 4.4%. So that's how it looks.
And Katie, I have some additional numbers on that, and from the state Arizona Department of Health Services website. They don't talk about fatalities from coronavirus as a percentage of total cases on their main site, but they do talk about per 100,000 Arizonans. So per 100,000 people in Arizona, 29 of them at this point have died from coronavirus. I'm also looking, we might have a little better statistic here on that from the state too, as we're going through. But again, we passed 2,000 deaths today to give you an idea of how that compares to some of the other major causes of death in our state. We look right around the 3,000 mark deaths per year for Alzheimer's, about 3,000 deaths per year for diabetes. So and keep in mind, we're only, what, 4 or 5 months into this at this point?
Major health crisis, that's for sure. Sonia writes in, I'm on my 16th day of having COVID-19, 16 days already. Have some of the symptoms like coughing and a runny nose. My mother and father all came out positive as well. My father was hospitalized for 5 days, doing much better. That's great news. Both my parents diabetics, ages 64 and 65. That was just my biggest worry. We're all ready to have a normal life again. This really changes lives. It sure does. And there's more people, more Arizonans that are affected by this every single day. Sonia, thank you for sharing your story. And Elle's writing in, thank God I survived, but it was hell. Stay home, people. Just some incredible stories coming in from people all across Arizona. So for those of you just hopping on here, I want to remind you once again, the free testing place over at South Mountain Community College, it's up once again. You do need to bring your ID. It will be going on until 6 or until they run out of tests. Some days it is shut down early, so it's worth heading over there early. Go with a full tank of gas and plenty of water because the line is very, very long. How long is it taking some of you to get tested? I'm wondering, or get test results?
Oh, Angie, you just put this out here that she was tested 8 days ago and still doesn't have results. So that's a question for people. I mean, yeah, if you have a fairly mild case, you may be completely recovered before you even know you're positive.
Yeah. I had a relative that just tested, and I shared a bit of this story yesterday, who had to wait and wait and wait. And when he got tested on a Saturday, at that point, we were usually getting tests back by Tuesday, sometimes Wednesday. And I said, oh, stay home. You're going to find out by Tuesday or Wednesday. And it took almost 2 weeks for him to get the answer. So it's really gotten delayed quite a bit. So that is one thing to note. And that's one thing that frankly has got to change, because people are waiting to go out of their houses. They're waiting to go to work. They're waiting for a negative test so that they can move on with their lives. And if it's not coming fast enough, and a lot of people are asking, oh, Kelly, good news. Went to her healthcare provider and got her results in 48 hours. If you can go that route, that's great. Shannon writes in, it took my daughter 11 days. She had to call and wait on hold for an hour and a half to get her results. That's the kind of stuff that's got to change. And you know what? The appetite for that wait is lessening, because they're seeing athletes and other people get tests and get their answers back right away so that they can play that next game, or they wait 3 or 4 days and that's it. And then people are waiting in line at South Mountain and saying, I've waited forever. I got my test, like Bart saying, 2.5 hours. That's actually better, Bart, than what some people were waiting out there. And then waiting days and days for an answer. So that's one of the efforts that we hope is going to speed things up when they start to get this going a little bit more. That was one of the things the governor talked about yesterday. The other thing he talked about, Melissa, yesterday was this change, if you will, a new executive order on limiting restaurant capacity to 50%. And everybody said, what is the difference here? Really, the only difference was before it was a recommendation and now it's a requirement. Is that what you saw in your reporting?
Yes, that's the official statement from the governor's office on this. And there might be also some confusion when you've gone to a restaurant maybe in the last few weeks that you've seen, tables closed off and spaced further apart, and your assumption was, oh, well, they've done that for this 50% thing. But this is a new 50% hard number based on the fire code maximum occupancy. So in some restaurants, you probably won't see any changes because they've already purposely reduced their number of seats that amount. And some of those things, it's a recommendation. You hear guidelines, recommendations, but the governor really said this is a shall do. Everyone needs to do this at this point.
Bart also saying again, he got in line at 10:15 this morning. So he's saying he waited on that 2-hour wait out there, 2.5 hours to get his test, but starting at 10:15. Bart, pretty smart to go in the morning as well. It gets so hot in the afternoon. I don't think my car would make it out there waiting for that many hours. I drive a car with over 100,000 miles, and I hope that it would just stay on out there at that point. So Bart, we hope for a negative test, a positive outcome for you in all of this. Thanks for sharing your story and what it was like for you out there.
Hey, I want to point out, Marsha asked the question about please get stats on ECMOs. If we want to look at that, those are those heart-lung machines that kind of the patients that are doing the worst are put on. At one point, Banner Hospital said, remember that they had basically all of their ECMO machines in use. The reason why we don't have hard numbers on those is because that's a number actually that the state health department does not gather and from the hospitals on a daily basis to put out on its public facing website. We can tell you ventilator numbers though, if you're interested. Across the state, about 51% of all of the ventilators at all of the hospitals across the state are being used. That's 944 of the ventilators being used. And when you look at the COVID patients, they are the great majority of that, 615 of the ventilators being used are COVID patients. Those numbers increase every day.
Yeah, the 615 is up from yesterday. I believe yesterday it was at 570. So if there's any good news in all of this, it's that we have had enough ventilators through this whole thing. But you think of all those people on a ventilator right now, that those families are waiting at home. I don't know, Melissa, if you've ever had to say goodbye to someone, final goodbye to someone over the phone or on speakerphone. It is awful. And there's no privacy of the final conversation. There's somebody sitting in there holding the phone for you. Hopefully it's in my case, it was a family member and someone I could trust. In these cases, it's a nurse or a doctor listening to that emotional goodbye. I can't even imagine what these nurses and doctors have been through physically, but then also emotionally. You've shared all of these hard moments to be in the room, to be with those people, and then to hear that final message, whatever's needing to be said to that person. It is such a hard thing to go through. I just can't even imagine all these people having to deal with this. Lots of different comments coming in. I want to see if there were any other questions that we can get to. And I thought I saw one just a minute ago. Oh, Maria writing back. They need to show the ECMOs. They're the last chance. These are the last chance to save lives. Yeah, if we get any more information from the health department or from the state that those are posted, we'll for sure pass those numbers along to you as well. Amari writes, kids should be on vitamin C, vitamin D3, and elderberry. Yeah, all good stuff. Everybody's trying to get the vitamins pumping. I know I'm giving them to my kids and taking them as well.
And Katie, that's interesting. I've interviewed this week ICU nurse who talks about what they're giving people in the hospitals and who come in with coronavirus. And she said that they give everybody vitamin C and zinc and aspirin if appropriate. But really, if you're going to use vitamins or natural herbal supplements, or if you're going to do any of these kinds of treatments, you really want to talk to your doctor. There is a lot of information out there where people think certain things are best for coronavirus and not, of course, so you just want to make sure that you're doing anything under doctor's advice and that doesn't have any interactions with any other medications that you're on or conditions that you have.
And it's so great now to do the telemedicine visits. I don't know if you've done any of those. I just did one yesterday and it was just my normal checkup, but it was so great. There are some things that have happened through all of this that I think we could continue to extend this right past a quarantine or a shutdown, a visit over a camera like this. It was so easy to do. I didn't have to, I have a babysitter for my kids. My significant other could go first. He went, then I went, and we could both have our doctor's appointments right there. So it was really great. For those of you just hopping on, just to update some of the numbers that we've been tracking I'm getting another question in. Do they count retests from the same person? No, they work to deduplicate. It's a really important question. People are saying, is that the number of cases that is actually deduplicated? So if you go in and you're getting several positive tests, I have a friend who's a nurse who took her test and was positive and just was taking test after test to try to get back there to be a nurse again, to be working again. And every positive test that she got only counts for her. So those are work to be deduplicated. So,
yeah, so right. It's probably not a foolproof method. I know that they're working hard to make sure that when you see the positive cases in Arizona, that's at 1 case per person. Yeah. But keep in mind, these are huge data sets with lots of information, but at this point, that's what they're saying.
And as I always say, this is everybody's first pandemic. Pretty much everybody on the planet, that's their first pandemic. Unless you've been here since 1918, this is your first one. So everybody's trying their best, trying to keep you updated their best, trying to provide care as best they can, all of that. So for those of you just hopping on, I want to update everybody. The daily case count was 4,221. Confirmed deaths, we are over 2,000, as we've told you this week, with 44 new deaths reported in the last 24 hours. And the governor spoke yesterday. We had some changes on restaurants, or some more enforcement, if you will, on restaurants. And then also the Scottsdale School District moving their in-person starting date to closer to Labor Day, beyond that August 17th date. Any education information you need is on our Facebook page at abc15.com. And we've also got a whole section to coronavirus at abc15.com/coronavirus. And Melissa, I don't know if there's anything else that you want to add before we wrap up for the day. 30 minutes went by so fast. I appreciate you joining us on here and helping people find all the numbers they need and information they need on this. Yes, Sandra's saying, wow, 44 new deaths. You're right, Sandra. A huge number overnight. We don't know if any of that is coming from the lag in reporting over the weekend. We'll obviously take those numbers and average them out over the week so we can see a trend in this instead of the peaks and the valleys, and help to work through those numbers as well. All of those are going to be plotted back in onto the appropriate date. But yeah, 44 overnight is a huge number. Jeremy saying thank you. You're so welcome, Jeremy. Melissa, any other things that you would like to add before we sort of wrap things up for the day and call it a weekend? Oh,
the one thing that I wanted to add is talking about folks probably have wondered why they haven't heard as much about hospital numbers this week in our reporting, and that's because they've remained fairly consistent. It's still high. ICUs across the state, 89% full, inpatients, 88% full, 50% or more of those patients are coronavirus patients, according to the state data. So, I mean, if you think about, like, half the people in hospitals in Arizona right now are coronavirus patients. It's incredible. And so those numbers have held fairly steady, but keep in mind, we've done some things in the hospitals recently. There's a big effort with the surge line to call and move patients to other facilities. Even so, some of the hospitals have had to go on diversion, where they stopped taking patients for a while. Also, we've cut down on the elective surgeries in many of the hospitals and things like that. And in addition, we might be seeing some moderation of those hospital numbers because we've seen a larger percentage of the coronavirus patients being younger people, and so they tend to have somewhat less severe reactions to the virus, and so you may see less hospitalizations per total number of people who have it. So I just wanted to kind of update folks on that, because a month ago, that's all we talked about, is how many people were in the hospitals.
Pamela saying thank you. Pamela, you are so welcome. That's exactly why we do this, just to be able to hop on here, take a little time, and hopefully provide you guys with some of the answers, some of the numbers that you don't necessarily have the time to check every single day. We're staring at it all day long. Melissa, can you believe the first day that we talked about coronavirus on the air was back on January 17th? And here we are in July. At that point, it didn't even have a specific name. It was a mystery illness that we had just started reporting on January 17th. Here we are in July. Just unreal that all this time has gone by, and we're still deep in this fight here in Arizona. So thank you for joining me on here today.
Thank you for having me. And we hope that everybody who's been watching us, stay safe, stays healthy, listens to that advice about you're safest at home and to wear a mask. And that's what we have to protect us at this point. So as we move forward, just everybody, look out for each other and take care of yourselves.
Absolutely. And remember, our newscasts are at 4, 5, 6, and 10 p.m. And you can also find all the very latest information right there, as you saw, abc15.com/coronavirus. If you have more questions for next week, Garrett is going to be all refreshed from his 3 days off at home, going from the living room to the laundry room. We'll have him back as well to break down the numbers over the weekend and give you more perspective on what all the numbers mean. But in the meantime, you can leave me a question or comment if you need on my Facebook page. That's probably the best place to do it. It is facebook.com/news from Katie, and then we'll get those questions answered for you this week. Melissa, thank you so much, and thank you to all of you who've joined us on here, and we will see you tonight on the newscast. Good night.